For our next video, we're going to be talking about mechanical ventilation, weaning, and BiPAP administration. Here we have Ms. Tubbs. Ms. Tubbs has lived with COPD for 35 years. We want to kind of work with her and see if we can wean her off of her mechanical vent. She's had some trouble in the past coming off of it. So we're going to do some weaning parameters today and see how she does. With a COPDer, they are going to have a totally compensated respiratory acidosis blood gas. That just means that their pH is going to be a little bit lower than norm, and their carbon dioxide is going to be a little bit higher. So we're not going to normalize her ABG to be like you or I. They have a completely different ABG. Ms. Tubbs is currently on volume control SIMV at a rate of 10. Total rate, she's showing at 13, so she's breathing a little bit over the vent. She has a mechanical tidal volume of 450 mils and a spontaneous tidal volume of 250 mils. She has pressure support of 5 and PEEP of 5, with her FiO2 set at 35%. Her vital signs are stable at this time and normal for her age and cardiopulmonary disease history. Her SpO2 is 91%. We're going to try to, per the doctor, he wants to see how she does with some weaning parameters. So what we're going to do is we're going to titrate her rate down by 2 every 30 minutes and just continue to monitor her and see how she does. This can be done by monitoring her vital signs, using ABGs to make sure that she's continuing to ventilate properly. Our FiO2, pressure support, and PEEP, those could be adjusted, but I don't think it's necessary for Ms. Tubbs. We will continue to assess our ventilation and oxygenation with ABGs, pulse ox. We want to keep her stats above 90%. We'll continue to auscultate her, make sure that she's got good bilateral breath sounds throughout. We want to keep an eye on her, make sure that we don't see any distress forming, vital signs, and her ability to follow commands. We're going to go ahead and turn her all the way down to 4, a rate of 4, and then we'll place her on pressure support ventilation, a pressure support of 5, and a PEEP of 5. And her FiO2 is going to be 35%. After an hour on these parameters, we're going to collect some weaning numbers. So for her, we're going to want to see a spontaneous tidal volume of 300 mils, a respiratory rate around 20, Tobin index of 67, a vital capacity of 750. Her NIF is going to be a negative 29 centimeters of water pressure, and non-invasive oxygenation and carbon dioxide values are going to be 92% O2 and 49 CO2. She passes her weaning trial, so we're going to extubate her. So we're going to deflate the cuff. Oh, cough, 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 cough. And then we're going to put her on 2-liter mask to maintain that oxygen level, but not too much because we don't want to knock out her hypoxic drive. But Ms. Tubbs is just not doing well. She is showing some signs of tachypnea, and we want to just nip this problem in the bud before it gets too bad. So we're going to put her on BiPAP. Normally you would make sure that you have the right size BiPAP mask by measuring on the packaging of the BiPAP mask. There will be little size indicators of small, medium, or large. This is all we have today, so this is what we'll be using. Want to make sure that we get this on here tightly enough so that there aren't any leaks, but not too tight to cause any skin breakdown. We're going to set, let's see, sorry. We're going to make sure that it's comfortable for her, make sure that she's not panicking. A lot of people have some claustrophobia issues, so we want to make sure that she's comfortable, and she seems to be. We're going to set our initial BiPAP settings at a 10 of BiPAP and 5 of BiPAP, so that's normally set 10/5. We want to continue to monitor ABGs, just to watch that CO2, make sure it doesn't rise or fall excessively. And we don't want that CO2 to increase, because then we would need to call a rapid response. And that's just, we don't want that, that's for sure. Because then we can see that Ms. Tubbs is close to failure. So she seems to be resting pretty comfortably. We'll continue to keep her on the BiPAP, and that's all. Thank you.